Hello everyone, my name is Tammy Pleasant. I am a digital product educator for Elsevier, and today I want to welcome you to this webinar on teaching conceptually classroom and clinical ideas. Hopefully you'll gain some ideas that you can take back to your classroom, your lab environment, as well as in the clinical to help you with conceptual teaching. So to begin this, I think it's important for us to just quickly review some conceptual teaching principles. We'll want to keep these in mind as we're planning classroom and clinical activities. So just basic principles of teaching conceptually. You want to always make sure that you're giving students ownership of their learning. You're using active learning strategies in the classroom, lab, and clinical. Keep those students engaged. We are flipping the classroom. We are, and that's a buzzword, a buzz term, I think. But I think what it's basically saying is we need to require our students to come to class prepared for the classroom content. We need to stop isolating education into silos. For centuries, we've separated theory, lab, and clinical teaching. We need to blend all that together as it relates to concepts. Clinical teaching should be intentional, and we should focus our clinical teaching on the concepts. When we look at the classroom, we should always have a patient in the classroom, whether that's a case study, whether that's a story from our practice, or it may be a patient that one of our students took care of in clinical. And of course, we want to build on prior knowledge. So let's talk about classroom ideas for conceptual teaching. First of all, we always want to think about our classroom as being student-centered, not teacher-centered. As in this picture here, we certainly want to say yes to a student-centered classroom. We don't want to be the sage on the stage. We actually want to be the guide on the side. As you're planning for your classroom activities, you want to think about making sure that the classroom activities are at higher level thinking. If we look at Bloom's, students can get the remembering and the understanding on their own. This should be your pre-class assignments. Assignments should be things that would help the students recall the facts and the basic concepts, or be able to explain or locate or at least recognize the information. When they come in the classroom, here's where we want to start at application and higher. We want to help them to be able to use that information in new situations, implement, that's all about taking care of a patient, demonstrate, explain to their fellow classmates rationales for questions, analyze. We want them to be able to, take a situation, look at the multiple facets of that situation, compare and contrast, and make a decision. Certainly evaluate is higher level learning, and of course creating. Having students actually create concept maps and creating their own case studies, creating teaching materials and practice test questions. All of this takes the student to those higher levels of learning. So here's one idea for the classroom. I call this focus reading questions. Your focus reading questions would be questions that you, the faculty member, would actually provide to the student, whether it be in a study guide or if you use ebooks, which I did when I was teaching, embed those focus reading questions in your ebook and share those highlights and those questions with your students. Make sure you have questions that are covering the concept and the exemplar. And then, in class, tell your students that you will be randomly selecting students to answer the focus reading questions. You can take that focus reading question a little further and tell students that as they're answering their questions when they're doing their reading, they should look for a YouTube video, for example. Find a YouTube video that explains or exemplifies the concept to them. And then randomly select a video, have the student come up, show the video, and explain how it really helped them to understand the concept. It's key when you're in the classroom not to give students all the answers. We are all accustomed to being in the clinical situation. Student comes to us, asks us a question. I can remember one particular situation when a student came to me and asked me, it was a fundamental student, and they asked me how many milliliters were in that coffee cup. And I knew if I just told the student how many milliliters we knew were in that coffee cup, it wouldn't stick. So I said to the student, I'm not going to tell you. I want you to figure that out. Student did problem solve, got a 30 milliliter medicine cup, went to the medicine room and used the medicine cup to determine how many milliliters were actually in that cup. That was not giving them all the answers. Do the same thing in the classroom. When you're presenting information, if you're presenting key points or in lecture, the first part of your classroom might be lecture time, don't give them the priorities. Have them determine the priorities. This is critical thinking, and they need to practice this in the classroom. That's thinking like a nurse. So design your group activities where the students have to discuss and determine the priorities for caring for patients. Here's an activity using the concept of gas exchange and the exemplars of the anemias. This activity will actually take the students to application and higher level learning. I actually had a faculty member that was using this activity, but more at the knowledge and understanding level, and we talked about ways to take this activity up a notch to the application level. So here's what happens with this activity. The students have classroom prep to do their reading assignment. They may have a focused activity or assignment that helps them with that remembering and understanding of gas exchange and the anemias. And then in the classroom, we do this application activity. We place flip charts around the room. The students are divided into groups, and then each group is assigned a patient with a type of anemia. On the flip charts, the students will identify the priority nursing assessment findings. They'll identify the priority nursing interventions. All of this for their specific patient that has a specific type of anemia. The next part of the activity is that students, their groups will actually rotate, move from poster to poster or flip chart to flip chart, and discuss, compare and contrast, talk about the differences in their patients, the similarities in their patients, and of course reinforce the explanation of how anemia exemplifies gas exchange. And throughout this activity, the faculty is actually facilitating with critical thinking questions and being certain that students are actually explaining the anemias and how they exemplify gas exchange. Provide NCLEX style questions in every class. Make sure you have questions related to the concepts that the students are learning and the exemplars. So for the faculty, your pre-class prep would be, say, to create a custom adaptive quiz. Select a few questions related to the concept and the exemplars. In the classroom, work through these questions together. You can use a think, pair, share type of activity where two students pair together, they think through and answer the question, and then they have to share their answer and rationales with the classroom. You can also use classroom clickers. Of course, if you have official classroom clickers, you could use those. There are lettered note cards that you can purchase or make with colored note cards. And of course, there are multiple mobile device applications where you can actually have the students answer questions, and we can anonymously see the trend and the answers. And of course, having a discussion about the answer and the rationales is key. Never underestimate the power of a case study. We go back to those principles. Your case study is definitely that patient in the classroom. Your case study certainly could be your way of building on prior knowledge. So always keep in mind how powerful a case study could be. After a concept is presented in class, you could actually divide the class into groups, assign each group a case study reflecting the exemplars. You want to make sure that you're using case studies for the exemplars across the lifespan. We know that a characteristic of many concept-based curricula is that it's concepts and conceptual learning, it's across the lifespan. So for example, let's say that I have the concept of gas exchange, and two of my exemplars might be asthma and COPD. Now I'm going to make sure I give one learning group a case study related to asthma. I'll give the other learning group a case study related to the COPD. They'll work through their cases, and then they'll present the case study to the rest of the class. I, as the instructor, will be sure to facilitate the connections. I want to make sure that I help them compare and contrast. What's the differences? What's the similarities? The concept was gas exchange. Both patients that you all were taking care of had problems related to gas exchange. So never underestimate the power of a case study. Use these case studies to build on prior knowledge, as I mentioned before. Students get to know the patients in their case studies, and this gives context to their learning. For example, I can bring a case study back into the classroom later on in another course so that I can show the interrelatedness of the concepts. So here's an example. This is the patient, George Jones. He is actually the case study in Dr. Giddens' book, Concepts for Nursing Practice, for the chapter of perfusion. And George Jones comes into the emergency department with chest pain. His history reveals he's a smoker, he's obese, he has type 2 diabetes, he also has hyperlipidemia and hypertension. And of course he undergoes a cardiac cath. He has one artery with 90% blockage, and he ends up with a stent. And initially, when the concept of perfusion is taught, and this case study, George Jones, is used, this is probably the first semester, the first time perfusion is taught, and the student uses the case study to understand, how all these risk factors, for example, impaired his coronary perfusion. How having the stent placed improves the perfusion. What types of nursing care does a patient require before having a procedure such as that, and then what do they require after a procedure such as that? So that's the first time the concept is taught. We taught perfusion. Okay, later on in the later semester, maybe our concept is mood and affect. We're going to pull George Jones back into the classroom. The students already know him, they know his history, and we're going to use George Jones to help the students understand the relationship between cardiac disease and depression. Patients who experience severe cardiac events, patients who have extensive cardiac surgeries often suffer from depression. Helping the students understand that by using a patient that they already know. I can again use George Jones in another semester, maybe the concept of sexuality, and helping the student to understand first and foremost the correlation between perfusion and sexuality. But maybe George Jones has recently married, he's had another cardiac episode, he comes into the hospital, we find out that he's been taking medications for erectile dysfunction. How are you, student nurse, going to explain this to your patient? A very application, real-life way of helping the students with communicating on a sensitive topic, but also seeing the relationship to perfusion and the concept. And of course, one of the big pictures is helping the students pull it all together. In the classroom, from day one, from the first time you teach a concept, we know that it's important to, again, we're taking the student application or higher. We want them to think about how, for example, perfusion and mobility are related. Every fundamentals course, I'm almost certain, includes mobility, the patient who's immobile, how important it is that we encourage them to do leg exercises, they wear anti-embolic stockings, and we're stressing the importance of improved perfusion for that immobile patient. We need to do this continuously. Okay, every time a concept is taught, we can bring in this interrelated concepts graphic, and we can have the students discuss how they're interrelated. Make it a group activity. Assign each group one of the interrelated concepts. Let them discuss and identify how perfusion relates to nutrition, how perfusion relates to elimination, and discuss nursing measures that they would implement to, say, prevent a problem of elimination or gas exchange. Okay? Okay, let's talk about some clinical ideas. Clinicals should be the students' time to shine. This is when we hope to see them take the things that they've learned in theory, in the classroom, and pull it all together. So we want to make sure that that's what we're doing, and that we're not focusing our clinical activities on checking off procedures that they've done, or making sure that they've done everything for their patient from A to Z, and that's all they've been able to focus on. We want to help them to think like a nurse, which is what they need to learn how to do. You need to take what they've learned in the classroom, bring it to clinical, and practice thinking like a nurse. Let's talk briefly about traditional clinical assignments. I know I speak for myself as well as many of you possibly, and traditionally our clinical assignments were very focused on total patient care. They were focused on individual student work rather than collaboration. We also had skills and tasks that were the focus of many clinical experiences. Students actually would determine the value of their clinical based on what skills and procedures they got to perform. We had them repeatedly performing routine care tasks. They had to do extensive written work, those long care plans, those medication cards. We would actually increase the quantity of activities as they progressed through the program. And the student who was in one of their last semesters was taking care of more patients, but we were increasing the quantity. And of course, faculty was spending a lot of time checking off student documentation, supervising skill performance. We were spending valuable time that we could have been using to drive critical thinking and clinical judgment. In the conceptual clinical model, clinical teaching should be intentional and planned. We should spend just as much time planning clinical experiences, making sure that we're addressing student learning outcomes, and that the students will get a real thinking experience in clinical, not just luck of the draw. We need to make sure that clinical teaching is focused on the concepts. Clinical teaching should bring theory to clinical. We've spent time in the classroom bringing clinical to class, now let's reverse it. Clinical teaching should deepen and extend that theoretical knowledge. Of course, clinical teaching should help the students develop skills in clinical judgment. They've started those activities in the classroom, but now we're taking them to another level in the clinical environment. Clinical teaching should help students develop an understanding of the culture of healthcare, not just the patient and the diagnosis and the medications, but the entire culture of healthcare. Clinical teaching should help students develop proficiency in essential nursing skills within the context and connected to concepts. Students need to understand the why related to nursing skills, really much more than the how. And clinical teaching should encourage collaboration and teamwork. We know that peer-to-peer learning is very effective, and we should encourage that in our clinical activities. Here's another early program activity, clinical judgment and vital signs. I think all of us as nurse educators can relate to the teaching stethoscope and going from room to room and listening to the blood pressure and the apical pulse as the students were assessing vital signs for that first time on their patient. Of course, what we're listening for is, did they get the reading correct? Are you within 4 points, plus or minus, of what I heard? Okay, and yes, it is critical that they have to learn how to do these skills, but just as critical is, what do you do with that information? So, are the vital signs normal or abnormal? Are there specific trends in this patient's vital signs? Can you do a little investigation on the medications that the patient is on? And could they have medicines that are affecting the vital signs? What about other factors? What about pain? And then once you assess these vital signs, what do you need to do next? Is there somebody specific you need to report this to? Or if it's out of what you learned as a normal range, do I need to report that to anyone or not? These are all questions that take assessing vital signs to a deeper learning level. None of those things that I really practiced when I was really starting students out with checking vital signs. I just wanted to know if they could hear it within 4 points of what I heard. Here's a really fun, cool activity for clinical, getting carded. And if this activity, actually I got this activity from watching a Nurse Tim video. But the student, we actually will have 3 cards. The concept of the week, of course, is decided upon by the instructor. Student writes that on one card, and then the other 2 cards, the student decides what are 2 other interrelated concepts to my concept of the week. The student keeps those cards in their pocket during the entire clinical time, and then at any given time, students can be carded by their instructor or by their peers. You could even have some of the nurses that are taking care of the patients card the students. And then of course at that time the student has to explain how the concept and the interrelated concepts apply to their assigned patient. Here's a clinical activity that a Texas school, that is a concept-based school, actually uses. And they have a 12-hour clinical day. The clinical group is divided in half, and the day is divided in half. And so for the first 6 hours, half of the students are providing patient care. The other half are performing specific activities focused on the concept of the day. At midday, the patient care group gives an S-bar report, and they switch roles with the other group. And then, of course, in post-conference, we spend time debriefing, where they compare and contrast their information. They're taking care of the same patients as if it was 2 different shifts, the first 6 hours and the second 6 hours. They're actually able to compare and contrast the findings. If we go back to that vital signs example, we can even think about, what were your assessment findings in the morning as related to the assessment findings I had in the afternoon. Let's compare and contrast. How were they alike? How were they different? Think about blood glucose levels. Early in the morning, a fasting glucose level, the first nurse actually did that and maybe got a normal or lower end normal reading. But the afternoon group, when they're taking care of when that student's taking care of the patient, that blood glucose level might be elevated. Let's talk about that. What are the factors that led to that? Collaboration in clinical between students is an awesome way for students to learn. Actually, you could have a very complicated patient who has multi-concept issues, and I used a patient such as one who might have diabetes, end-stage renal disease, a diabetic foot ulcer that's infected, all of those things. That's a pretty common patient in my region. And students would actually be assigned to that patient in the past, and there would be so many medicines to look up, there would be so many things going on with this patient that the student was more focused on the individual things they had to accomplish versus how it all fit together. So I actually used this activity. So I paired the students off. 2 students would take care of this one patient. The concepts that were related to this patient, they would divide. And then throughout the day, they would collaborate. One student may have glucose regulation as a concept, where the other student had infection. And they would collaborate and discuss how the infection is impacting glucose metabolism. What is that glucose level running? Also, they would be responsible for learning the medications for their concepts and explaining those medications to their partner and having discussions on how they could interact. Here's an example of what I often call the general survey, but there's an official title, the 60-second situational safety assessment, or the doorway safety assessment. The student actually, takes note of who's in the patient's room, what tubes, what lines, what equipment does the patient have. The student does a quick environmental survey of the room, focusing on any safety concerns. These are really cool activities to do during clinical downtime. There are also very focused ways to use the 60-second situational assessment, and here are some examples. The student enters the patient room, observes the family, the patient, takes 60 seconds to just assess ABCs without touching the patient. Is there data that leads you to believe there's a problem? This is a 60-second assignment focusing on the concepts of perfusion and gas exchange. Another example. Very quickly, 60 seconds. Is the IV solution the correct one at the correct rate? Does the patient need these tubes? Okay, if so, why? Or do you note any complications? Are there further assessments that you need to do? These would be cool examples for doing that quick assessment related to the concepts of safety and fluid and electrolytes. And then here's one more example. This one is related to using your senses to do a 60-second assessment. What are your senses telling you? Are you hearing things? Are you smelling things? Do you see things in the room? Or do you feel things that indicate that maybe you need to explore those things further? I think of this as a really cool way to do a quick assessment of the concepts of elimination, infection, inflammation, gas exchange. So, during your downtimes, encourage your students to go do a 60-second survey or 60-second assessment and pick a concept. Here's an activity that you could do in clinical to assist the students with understanding the culture of healthcare. Most every nursing program has medication administration in that early semester of the program, first or second semester. Of course, we teach the students the rights of med administration. They learn all about the appropriate size needles and the volumes that you could administer, the various ways, and so forth. But the culture of healthcare, those other things that actually happen when the student is in the clinical environment, we don't always focus on those. So, things like, when was this medication ordered? Okay, how did this medication end up showing up on the MAR? How do I know it's right on the MAR? Where did the MAR come from? What do I do if the medication that's, say, in the patient room drawer is not the same as what's written on the MAR? What if it's missing? How do I know whether this medication is in the patient's room or is it in a local or a centralized place like a Pyxis? We all have experienced this. I drop the pill, how do I get another one? We usually don't talk much about that until it really happens. Okay? And then, of course, things like, what if I gave it at the wrong time? I gave the medication, what do I need to do next? There are so many things about administering meds besides just those 6 rights of medication that sometimes we overlook that, and it's important to include that in your clinical teaching. And of course, we come to post-conference. And post-conference has comprised of many different activities through the years. I know for me, I often spent time having each student talk about the patient that they took care of today, or tell me what you learned today. And it was, very superficial. They were mainly just reporting things to us, but I wasn't at that point doing a whole lot of facilitating deep learning. So conceptual teaching and teaching in a concept-based curriculum and staying focused on the concept gave me the opportunity to take those post-conference time periods and try to drive deeper thinking. So for example, Socratic questioning. Of course, have the students tell about their weekly concept, give an example of a nursing intervention focusing on this concept that you performed today. What lab or diagnostic data did you use today that helped you to really focus on the weekly concept? How is that weekly concept interrelated with previously learned concepts for your patient? So just a variety of ways of really focusing in on the concept. Another really cool activity is using adaptive quizzing. Actually go in and during post-conference have each student identify what their primary concept of focus was today for their patient. Have them go into their mobile device, their computer. They probably had to keep their cell phones locked up or in their pocket. Now is the time they can take them out and actually go in and create a custom self-quiz with 5 to 10 questions depending on the time you have. And those questions would be related to the concept that they chose as the primary focus for their patient. Complete the quiz, and now they're going to discuss, they can ask questions, they're going to explain the rationales to their fellow classmates. And that's just a real quick and simple way. And actually, the faculty member didn't really have to do anything to prep for this other than to, make sure they had their devices and they had access to their adaptive quizzing product. So I hope you've gathered some ideas that you can take and put into practice as you're moving in your conceptual teaching journey, whether you are already in a concept-based curriculum or even in a traditional curriculum. You're looking at ways to actually beef up your classroom and clinical where you are engaging the student more, you're doing more higher level learning activities. Take advantage of these activities and hopefully you will have as much fun teaching conceptually as I did. Thank you for your time.